Good morning, everybody, and welcome to our first COVID call of 2022, although unfortunately it feels a lot like 2021 and as far as infections and what have you is concerned. But I'm going back to the 70s today and wearing my Mike Dukakis sweater. You remember during the blizzard of 78, all of you older people like me, Mike Dukakis had a sweater. Yes, Laurel's putting thumbs up for all of his releases. And so I guess that's appropriate, our first snowstorm of the season. I do want to thank everybody for all of their hard work over this, particularly our members of the Health Department and Board of Health. You have done just yeoman's work, and in thinking about the rising incidents everywhere and what's going on. But when I look at our percentage of people that are vaccinated, which is, at least 85, almost 85, 86% have at least one dose. A lot of work was done for the last year by a lot of people that are on this call to make sure that we got that done. And I think I'm going to jump out on a limb, and I know that Anthony and Laurel and Elaine will set me straight on this. The vaccine and the booster is working. I mean, this does not mean that nobody gets symptomatic. It doesn't mean that nobody gets a positive result. It's like the flu shot. You still may get the flu, but it won't be as severe. And I think that's where we've been. So Wakefield positivity rate of 15.89%. And, while that is very tragic, we believe the number is much higher because, of course, people are using rapid at-home tests, which showing that they're positive there as well. So a lot that's gone on. I hope you all had some pleasant New Year and Christmas and the holidays. And I'm going to turn it right over to Anthony, who's been a busy guy. But that's what we got him for. So it's all yours, Anthony.
Thank you, Steve. So right now in Wakefield, we are, just like all the other areas around, we're in the middle of a surge. We're seeing a lot of cases, especially in the last 2 weeks. Over the last 2 weeks, we've had 630 total cases, and currently we have 814 confirmed active cases. And so this is affecting all parts of our community. This is not just the schools. This is not just this is everybody. We are seeing cases go up everywhere, and it was somewhat to be expected with everybody gathering over Christmas and New Year's, but we have a lot of tools at our disposal. And so one of the things most recently was the indoor mask mandate that was passed this week. The mask is just one tool that will help us mitigate the spread in indoor spaces. And so we're really hoping that folks understand that, while not a permanent measure, I think the masks in combination with our vaccination efforts will really help drive down these numbers. To my understanding, Omicron variant has taken a hold across the nation. It's currently anywhere from 59% to about 68% of all cases in the U.S. And so what we want everybody to understand is that Omicron may have more mild symptoms in general. Delta is still out there, and people are still getting it. And so we want people to understand that vaccination and masking are the two safest ways to really prevent getting COVID in the first place, and also protecting those around you. While we're looking at the vaccination rates, Wakefield has done a great job across almost all groups. Everybody has really stepped up and gotten their vaccination and tried to get their booster as well. One of the groups I wanted to focus on are the 5 to 11 group. And so that was the most recent group to be approved for the vaccine. And so looking at the numbers, we're just over 50% of those 5 to 11 that are fully vaccinated. And if we can really work on this group and provide the services and provide the vaccination, I think we can really help protect the schools even further. One of the things that we wanted to go over in terms of news was that 12 to 15 age group was recently approved for boosters. And so we will be looking for opportunities either to work with the state or through our local health board of health to really provide that booster in the most accessible fashion. And so we want to make sure that we are helping to keep the booster accessible for all age groups And by doing this, we can really help protect Wakefield. I guess the biggest takeaway that I want to, give everybody here today is that we're doing a great job in Wakefield. We're doing everything we can to make sure cases don't spread, but we don't exist in a vacuum. We have lots of visitors. Our county area here, lots of people travel between our area and others. And so we just want people to understand that these measures are not aimed to be punitive for Wakefield residents. We just want to protect ourselves and everybody who comes to our town.
Thank you, Anthony. I think I'll run over to Doug, the state of the schools.
Thank you very much, Steve. Anthony, thank you for your words. I think you've covered a lot of ground there. We've collaborated with the Board of Health and members of the Board of Health a couple times this week. We appreciate the support and the guidance. Anthony also joined the Middlesex League Superintendents on a call this week to talk through our COVID numbers, how the district and how the league, the 12 districts included in the league, are managing testing, which Anthony has been a part of that, and also how we can continue to support with vaccinations. And so, as Anthony has said, it appears that with the Omicron variant, that for those that are vaccinated, it appears that the symptoms appear to be more mild than Delta, and people appear to be recovering more quickly, again, if they are vaccinated and boosted. And so that is kind of the single, looks like the greatest deterrent from becoming very ill with this, becoming infected with this variant. The numbers this week in the schools really haven't been higher. And so we're at 163 students, 36 staff members for 199 total. This number it exceeds our quarantine numbers, which are 147 students and 2 faculty members. And so that's a first that we've seen, kind of the flip, where our positive rates are higher than our quarantine numbers. So we will continue to work with Board of Health and Department of Elementary and Secondary Ed and Mass DPH to implement the new guidelines. We're also meeting this week with Anthony and his team to really take a close look at contact tracing, because as Anthony said, we don't live in a vacuum. And really what that means is that we're seeing the transmission of positive cases in so many different areas. It's making it very, very difficult to contact trace. And so we are going to be meeting next week to talk about how we might respond to those challenges. And we will be getting more information out early in the week, likely by Tuesday. And then again on Thursday, we will have a call to update where we are with the schools. So that's where we are presently. Appreciate the opportunity to just share what we're doing.
Thank you, Doug, and thank you for all your hard work. And I think a reason why we really helped stop the spread even further in the schools was some actions taken by you and by Tom Walsh, our EMD director, who made sure that we got a lot of people tested before school started. So Tom, I'm going to throw it over to you. Great job as usual, and great foresight to go out there and get that scheduled and ready before the panic set in with everybody else. So great job.
Thank you. I just wanted to give some numbers on some things so people understand. My job is trying to get people at this point vaccinated, and I'll give you the reason why. 80% or more of the total hospitalizations in this country are either from unvaccinated people or not fully vaccinated people. And what that comes out to is that you're taking a bed away from someone who is ill, maybe from an unpreventable disease or accident or whatever. So please go out and get vaccinated. You know, you can go to your pharmacies. We'll be running some vaccine clinics down the road. Anthony has approved a couple of things. So we're going to try to get everybody together, but those numbers there should tell you that, first off, you can still get sick and get hospitalized if you're not vaccinated or fully vaccinated. Please go out and do it. That's what I have.
Thank you, Tom. Thank you. I'm going to ask Julie Smith-Galvin, Chair of the Town Council, who's been so supportive through this whole thing. So thank you, Julie, for all your support at
Well,
my level.
it's easy to
everybody
be
else,
supportive
right?
with a team like this. So I don't have a lot to add. I'm just so proud of this team. I am so devastated by the numbers and what is happening, but I really believe we are doing everything that we can, and as a town, and that people have to step up and also take personal responsibility. I thank the Board of Health for their meeting this week. I know it was tough, and I'm really grateful that you made the decision that you did. But I thought you listened respectfully to everyone. And we do need to hear all the opinions, but I think it comes down to the science, and that's what, as a town, we're following. So thank you all so much.
Great. Thank you, Julie. Laurel, just because you're first on my screen.
Good morning, everybody. Happy New Year. And happy first real New England snowstorm. It's bright and fluffy. I can't wait to go play, which would be good for your mental health. And the 7-year-old across the street is already out. So I'm pretty, like, let's just embrace the joy of a pretty snow day. I echo what everyone said. I do, I am feeling, I recently have finished a background in psychiatric and mental health, and I am feeling a prolonged grief kind of collectively. And I think that's really what we heard from many of the speakers. And, I think we have been, we have been hashing through this stuff. So sometimes we get comments that the board has been silent on some things. We're not silent. We're a board, and by law, we can't make decrees unless we've just met as a group, and we meet monthly or more often if that has to be. But as evidenced by this call, we are in it every day. We're looking at the data every day. And when people are making good decisions, we are not going to get in the way and add to any more announcements that have already been made. So, just to review, we follow CDC guidelines. We get daily, or not daily, but intermittent bulletins anytime there's a change with DPH. We have a team, including Elaine, who have been, just keeping up with a rapid change. One of the things that I just want to, that we haven't mentioned in this call is a lot of talk about testing. And that's the other thing that is making, is giving, I think, some collective angst, because again, we have a scarcity and a rush on tests in the antigen test. And, so we kind of have the have and the have nots. There's definitely been some reaction time that is frustrating, but I feel like it's starting to ease. A lot of, I was telling people that we were playing either Monopoly and you kept getting in jail until you test it out, or red light, green light, which is a game we played when we were kids, which you had to test. And then if you were negative, you moved on. That was responsible, but it's for the people who had tests, not for the have not. So I am, we can't really control that market, but it is something that I think we need to be aware and just relax, do whatever you can for your own health. I would remind people that there's a lot of chatter around testing out. The new CDC guidelines have shortened isolation, kind of as I do believe it's a good move, but the caveat is that people may still be infectious, which is also part of what the rationale was to getting us to hang on to, to get back to a mask mandate. But do not agonize yourself and get yourself in a 3-hour PCR line if you had a positive PCR last week. PCRs do not clear. So let's say I had a positive PCR, which is the nasal swab that is sent to a lab, and let's say I have Omicron and I've cleared Omicron, my antigen test will be negative. My PCR may still be positive for 90 days. That's what we found last year. So we are noticing that there's lack of clarity in this argument out there. And it's causing some more angst. So hang in there. The CDC website keeps clarifying their information. It is rapid and evolving. So we're not, sometimes we're reacting. We're trying to be proactive. Masking is proactive, being as healthy as you can, and do take care of your mental health, please.
Thank you. Great advice. Today's a great day for a walk in the snow, people. Get that air in your lungs. It's not that cold. It's very nice. Elaine, how are you?
I'm hanging in there with the other many traces, and I want to give them all a shout out to them, because our job has become a lot more tedious, a heavier caseload. I probably will not see the snow today, Laurel, because I have quite a few cases to do today to catch up. I want to thank everyone here in the town of Wakefield for their cooperation, from the administration, Mr. Mayo at Town Hall, down to the school department, to Mr. Walsh, and to the everyday person who is listening to us and following the advice. You know, we know it does get confusing. You think it gets confusing for you. You should see me when I have to refer to a piece of paper constantly to make sure that, the information we are conveying is correct. The average person has been great on answering phones when the contact traces call. It does help. As Laurel mentioned, there's so much confusion out there and in regards to testing. And when you do talk to us tracers, we have been able to give a lot of advice and, thank people for doing what they're doing and following the rules and regulations. And all we're trying to do is to get through this and make it the best for everyone, for a good outcome. And a very big shout out for all of those on the front lines. I have many close relatives working in hospitals and on ambulances and long-term care, and they're doing an amazing job, let me tell you. And I thank anyone who is doing that. They're helping us also. And to wish everybody Happy New Year. And I don't know, Laurel, I hope maybe I will go out. I did take some breaths of fresh air early this morning. So maybe I'll go and try to do that in between a few cases. Thank you.
You should, Elaine. You used to run all your PTO meetings on the walk years ago. So you
Yes,
could
we
do that.
did. We used to do our executive board meetings for the PTO. Believe it or not, we used to walk the lake, and that's how we did our executive meetings. So, and I've done many a meeting in between some people before when I worked and walking, but I don't know about today. I have too many people I want to reach out there. I really want to get a lot of information out to people and try to help them and steer them in the right direction.
Okay, thank you so much, Elaine. Thank you
You're welcome.
for all your work. Jen has some information. She's going to put up. Jen's been a great job about, making sure she's on the ground floor of these and getting the information out to the public as expeditiously as possible and as clearly as possible. So Jen, I think, wants to maybe say a few words and put up one of the graphics that she's been working
So
on.
if you visit wakefield.ma.us, the indoor mask mandate language is up there, as well as some FAQs to make things a little bit clearer for everybody. I'm working with the Chamber of Commerce and Erin Kokenda, our Economic Development Director, to do outreach to the businesses. There is on that link, and they're going to share as well a entry door sign that the businesses can use if they choose. They could make their own if they want, but just to make it a little bit easier for them, business folks are free to print this out and use it as an entry door sign, just to make sure that the public understands this does go into effect on January 9th. And while I have folks a little bit COVID unrelated, but there is no trash and recycling pickup today. That's just something that was determined this morning. So while I have some folks on the line, I just want to let everybody know. Thank you. They'll
And that
pick
will
up
be
tomorrow, Saturday.
Right. Great. Thank you. Thank you for all of your great messaging. Well, again, thank you for all of your hard work. When I think about how many people this group was front and center on to make sure that they got their vaccines, and it's in the thousands that this group has made sure. So a lot to be proud of. I still throw a challenge out to Laurel and my children's groups. I think Elaine's are a little bit older. That 20 to 29-year-old group, they're still lagging on us, but they're getting better, but they're still lagging a little bit. So maybe a little peer pressure there would help out a little bit. So, wear your mask, get your shots, and be safe, everybody. And take care of your mental health, because that is really important. We're all feeling the weariness. So great advice from Laurel. Take a walk today and, make a snow angel, maybe. You'll feel better. So thank you, everybody. Anybody else?
Oh,
Have a
Steve,
great
can
day.
you leave the meeting open for a minute? If Doug is still on, I just want to talk to Doug for a second.
Sure. I'll leave it open. Okay.
Thank you.
Thanks, guys.